Hi friends, welcome to today's video on quality and patient safety in radiology department. So we'll see today what is radiology department in the hospital, what is the role of radiology department, and how we will keep safe patients in radiology department, and what is the quality requirement, NABH requirement. So this video will be in two parts. So today we'll see the part 1 and next I will upload the part 2 because it is a quite long video. So let us start. Radiology or radio diagnostic center. In hospitals, we have one department called radiology, and otherwise, radio diagnostic centers are also available in any cities, 2 tier, 3 tier cities also. Radio diagnostic centers are available where only they are providing the radiology services. There is no consultations for the OPD, or there is no IP admissions, nothing. Only the patients will visit to the radio diagnostic center, they will do the test and they will come back to show the consultant to the reports. But in the hospital, the radiology department is a entity of the hospital, one department of the hospital, where consultant will advise the radiology test like X-ray, ultrasound, CT, MRI, PET-CT. It is a radiology is the kind of the things like the medical imaging technologies. It through what through the medical imaging technique we will diagnose the disease, and sometimes through radiology we can treat the disease also. Different modalities are there in the radiology, as I told: X-ray, CT, MRI, ultrasound, fluoroscopy, mammography, nuclear medicine kind of PET-CT. X-ray is the ionizing radiation. It will create the 2D images. Digital X-ray nowadays are available. Whole part of the bodies, but any part of the body can undergo the X-ray, and like bones, chest, and the teeth. For the dental, like also dental X-ray is available, which is different from the general X-ray. So in X-ray, we can see in the hospital like fixed X-ray, mobile X-ray. So mobile X-ray will be used in the bedside. Fixed X-ray will be in the radiology department. And for the dental X-ray will be separate from the general X-ray. It will be only in the dental OPD. CT combines multiple X-ray images to create the 3D views. CT also, it is like X-ray film only, CT film also will come, and in CD also now it is available, but it will give the cross-sectional 3D views of the bones and organs. MRI, it won't create the radiation, but it is like strong magnetic field and radio waves are there to provide high resolution soft tissue images. So it won't, without radiation, it will give the high resolution image. Ultrasound, it will like nowadays to see the organs, tissues, everything. Ultrasound, like foot ultrasound also is being done. Then various part of the bodies also ultrasound is done. It is not like that only abdominal part, pelvic part the ultrasound can be done. No, in hand also ultrasound can be done, in foot also ultrasound can be done to see that the soft tissues. Fluoroscopy also, it's a type of X-ray only. Mammography, it is a low dose X-ray for the breast cancer detection, and in the mammography there are certain guidelines which needs to be followed, certain age criteria. The patient should be like below 45 will not be entered to the mammography. This should be the age limit. So it's certain criteria are there for the safety of the patients, and that also we'll see. Nuclear medicine like PET-CT, this is also comes under the radiology. So, requirement in the radiology department. What and all required to establish one radiology department? The radiology department will operate with all the rules, regulations, registrations without AERB, WABA Atomic Energy Regulatory Board is there. So, without AERB approval, one radiology department can't be set up. And for ultrasound, we have to get the approval from the Health and Family Welfare Office. So the rules and regulations we have to follow to establish one radiology department. We have to get the layout approval to install one equipment. Then we have to, after installation for operation, we have to get the operating license, and every time we have to renew the license as per the valid provided by the AERB. So as per for X-ray the validity will be different, for CT the validity will be different. So as per the equipment the validity will be different from the AERB. And we required one radiation safety officer also. Radiation safety officer, three label radiation safety officers are there: RSO label 1, label 2 and label 3. But if the hospital is not having the nuclear medicine, then they can go for the RSO label 1. If nuclear medicine is there and you are having the oncology also, then you have to go for the RSO label 3. Then staffs will be provided the TLD batches to prevent the radiations and to calculate the dose of the radiation. TLD batches are used to prevent the radiations. They have to wear the lead aprons, and the wall should be, the lead wall should be there. So as per the requirement, the facility needs to be arranged. Then they have to maintain the legal records for the radiology department to establish. And as per the law, we have to maintain the legal records for the time or for the years which is valid by the law. If the law is telling the record should be maintained for 5 years or 10 years, then we have to maintain accordingly. The records retention policy of the records will be depend upon the laws of the different states on the Indian law. As per the law, if you will see, the adults should be 8 years and the pediatric 25 years. But yes, in some cases, cancer cases, it will be till death, and after death also 5 to 10 years it should be kept. Registration certificates and acts, ARB layout approval is required. Then PCP&DT, as per the act of the PCP&DT Act, we required. Then the District Health Family Welfare Office, I already told. ARB approval we required. Then we have to follow the radiation protection rules. We have to follow the biomedical waste management rules. These are the requirement of the certificates and acts. Patient education and safety, the requirement in the radiology department. While undergoing the investigation, all necessary precautions related to patient safety should be explained to the patient. Whenever patients are taking to the radiology department for any investigations, patients should be explained the risk and benefit. Consent needs to be taken from the patient in the language they understand. Any X-ray also we have to take the consent, USG also we have to take the consent. Then MRI, CT, for everything patient should be explained the safety of the procedures, and that should be taken signature from the patient in the language they understand. Special care also is required while investigation of the infant, neonatal and the geriatric patients. Privacy is the most important thing. We have to take care of the patient during the investigations, and the patients should be allowed for the investigation with proper safety. Wherever required, patient will be provided the lead apron also, and the neonate infant cases where the attenders are along with the patient, then for the attenders lead apron to be provided to prevent the radiation exposures. And patient and customers will be drawn for the hygiene and safety aspects before undergoing the investigations. Consent, I told, is consent is required for the any procedure. All patients should be explained about their investigations in detail before starting the process. And to reduce and to minimize the discomfort of the patient and the pain during the procedure, patient should be counseled properly for the investigations. And patient details will not be shared by any of the staff with the other patients or the other family members who is not legally accommodated with the patient. Radiation safety. Radiation safety is equal for the patient and employee safety. Both are involved in the radiation safety. So first, in the radiation safety, we need to have a proper imaging instructions wherever the necessary. Without the consultant's requisition later, patient should not be taken for the radiology investigations. Wherever the radiation exposures are there, the consultant should write and give the requisition with the clinical diagnosis mentioned in the requisition form, so it will be easy to correlate the reports with the clinical diagnosis. And the radiologist should take care of the patient for the low dose radiations, because wherever necessary, how much dose of the radiation is required, that much only should be given to the patient. And they have to check the patient before taking. If the female patient, it is necessary to check the patient is pregnant or not. If the patient is pregnant or anything, then the as per the law, it should be followed. The patient should not be taken to the x-ray, and if the patients are necessary to take for the x-ray, then the following rule regulations are there, then they have to follow the rules and regulations. Patients should be patients should not get the more radiations. So these are the things needs to be monitored. And for the employees, there should be lead aprons, thyroid shield, gonad shield, and the dosimeter TLD batches should be there. And that the TLD batch every 3 months should go for the dose audit. If any employee are exceeding any dose or anything, if the employees are exceeding the dose, then they are not allowed to work in the radiation zone. So these are the radiation safety protocol, it should be followed. And everywhere the poster should be there for the radiation hazard. Every door of the CT, X-ray, there should be the license displayed with the radiation hazard symbol. This is the format for the license display in front of the X-ray CT room, wherever the radiation exposures are there. So license should be displayed in the door with this format and with this image. This is the mandatory from the ARB. It should be license should be displayed on the door. Then all mobile equipment should have the license to be displayed in the equipment itself. That is the mandatory. And the radiation hazard signages are also should be displayed in the radiation zone. Then patient identification and verification. Patient identification is the most important thing in the any field of any kind of department in the hospital, because patients are coming for the treatment. If the patient will not be identified properly, then there will be high chances of wrong patient taken for wrong treatment. So patient should be identified and verified properly. Patient should be identified with the two identifications: age per IPSG goal 1. Patient should be identified with two identification: patient name, UHID. And third, patient can be identified by the age also. If the patient name, both names are same but UHID will be different, there that case the patient should be identified by age. And verify the patient with the patient should be asked about their name, age, and the UHID that should be matched with the requisition form, and patient will be asked for the correct site, which kind of investigation they required and which side it is. That should be verified properly with the requisition form written. If in the requisition form the consultant has written left and patient is telling the right side the pain is there, then it should be cross verified with the consultant. Then only the patient should be taken for the investigation. Without verification, only verification with the patient and patient has taken to the investigation, it is not right. If the patient is telling right and doctor has advice for the left, then that should be verified with the consultant only. Then contrast media like contrast is used for in the CT, PET CT, plain CT also is there, and the contrast CT also is there. But wherever the contrast is required to be given to the patient, then the patient should be counseled properly before taking the patient or before giving the appointment to the patient should be asked for the any allergy to the any drug, and patient should undergone the creatinine test and GFR test. These two tests should be done. After that only patient will be taken for the contrast. Informed consent also required to take the contrast studies. Any CT, X-ray, anything, you have to take the informed consent. Already in my last video I have shown the informed consent for the procedures, so the same consent can be used. If anyone required the informed consent, can ask in the comment, so I will provide you the PDF of the informed consent. Then emergency preparedness, a casket should be there, because due to contrast patient can get the patient get arrest also. So for that reason the casket should be available. For any vital down, the casket is required, and there should be emergency codes aligned. So if the any patient is undergone the contrast, patient taken the contrast, and patient has got the emergency situation and patient has got the cardiac arrest, then the emergency code needs to be activated and crash card should be available in the radiology department. And every time if it is feasible for the hospitals to keep ready, then adrenaline, antihistamine and steroids should kept loaded and kept ready for the immediate action. Post procedures, patient should be observed properly. Patient should not be discharged directly to home. Patient should keep in the observation room to monitor the vital, to monitor the adverse drug reactions for the contrast. If any patient is getting any extra extravasation because of the contrast or any adverse drug reaction, that should be reported to the quality department of the hospital through the incident reporting form. So it will be done the root cause analysis and corrective preventive action to prevent the further extravasation and to prevent the further adverse drug reaction wherever necessary. Okay, so incident, RCA, kappa and all, I'll make one more video on the incident reporting, how to report the incident, what is RCA, kappa and all. Then equipment and machine safety. So equipment safety also is equally important in the radiology department. All equipment should go regular preventive maintenance, calibration and quality control test. So every year quality control test should be done, calibration should be done, preventive maintenance every 6 months, it is mandatory to be done. Preventive maintenance can be done by the in-house biomedical engineer, but calibration should be done by the one certified company who is having the calibrated equipment, and they will come and they will do the calibrate of all the equipment. They will give the certificate for the calibration of the equipment. Quality control test also will be done by the company itself, and they will provide the certificate on the quality test. Electrical safety checks should be done for all the equipment. Even electrical safety checks should be done for all over the hospital also. Electrical safety audit once in a year, it is mandatory, and it is mandatory for the NABH accreditation also. Safe handling of the portable X-ray MRI equipment is required. Staff should be trained on the handling of the X-ray equipment and the MRI. And outside the MRI, it should be clearly displayed that which and all the patient should remove all the ornaments before entering to the MRI room. So the clear instructions should be given to all the patients. Only patients should have the gown in the body. Apart from the hospital gown, patients should not have anything in their body, like chain, belt, or any inner wears, or the ring, bangles. Nothing. Patients should not have anything. That should be checked properly, because it's a very critical zone in the MRI. Then breakdown should be reported and corrective action should be taken. All breakdowns should be reported to the biomedical department, and through biomedical department the incident to be raised, and it should be submitted to the quality department. These are the equipment and machine safety where we have to take the necessary action on this. MRI safety, as I told, this is the signage which needs to be displayed outside of the MRI, and patient should not have any pacemaker, patient should not have any implant. So patient should be counseled on these things. If the patient is having any of the things, then its patient will not be taken for the MRI screening. So zones needs to be identified. No performagnetic object inside the MRI room. Hearing protection for the patient should be there, and emergency quench procedures known to the staff. What is the emergency quench? One quench ball will be there inside the one quench ball will be there outside the MRI room, and the inside the quench system will be there, where the staff should be trained. Each and every staff, including the doctors, including the DNB students, including the residents, everyone, and the staff technician, everyone should knows how to do the quenching. Then infection control is nothing, as everyone knows that hand hygiene, proper PPE they have to follow. Hand hygiene needs to be followed. The rooms, the table should be cleaned for each and every patient. The X-ray table, the ultrasound table, and the ultrasound probe needs to be cleaned for each and every patient. Then a contrast injector should be used different for the different patients, not to be the same for the every patient. Then MRI coils needs to be cleaned properly. So these are the things needs to be taken care, and safe disposal of the biomedical waste. So these are the infection control activities needs to be followed by each of the staff. Every staff should undergo the training once in a year, mandatory training for infection control practices. It is mandatory as per the HRM chapter of the NABH and infection control IPC chapter of the NABH. The every staff should undergo the hand hygiene training, proper PPE wearing, cleaning of the equipments, cleaning of the probes, then safe disposal of the biomedical waste. So every staff should undergo the training of the infection control, and this is the most important in the hospital. So friends, for today we will keep this much. The next part will continue with will continue the same in the part 2, the other safety concerns in the radiology department. So if any queries or anything, then please comment in the comment box, so I will reply to the comments. Any formats or any forms also required, that also please comment me. If anything, any suggestion you want to give to improve my videos, also most welcome. Thank you so much.